Welcome to this webinar on the RNAO-AMS Fellowship. In this information session this afternoon, we hope that you will develop an understanding of this new innovative fellowship. I'm your host for the webinar this afternoon. My name's Jocelyn Bennett, and Erica D'Souza is indicated on this slide as a contact person for the RNAO Fellowship Program, should you have any follow-up questions after this webinar. The objectives for today are really to provide you with an overview of the AMS Fellowship Program, explain and provide some examples of the AMS core themes, and really provide some examples of activities that relate to these core themes. So what are the core themes about and what relates to them? And then I also want to take a moment to relate the AMS Fellowship core themes to the relevant RNAO best practice guidelines. So the AMS RNAO Fellowship is a partnership between the RNAO and associated medical services with the goal to offer 8 fellowships over a 3-year period. It's supplemental or an additional stream to the Advanced Clinical Practice Fellowship, which is a self-directed intensive learning experience aimed at developing and promoting nurses in terms of their knowledge and expertise. The ultimate goal is in improving client care and outcomes, and as you'll learn through this webinar, the focus of the AMS RNAO Fellowship is on creating champions for caring and compassion. One of the questions I often get is, what is Associated Medical Services? And this is an organization that has almost 80 years of history. It is a not-for-profit association which is really committed to funding and supporting innovative research and education that will enhance and deepen our understanding of compassionate care and the compassionate aspects of healthcare in Canada. It was founded in 1937 as a not-for-profit prepaid healthcare organization, and actually when Medicare came into being in the 60s, early 70s, the AMS's role as a healthcare provider ceased to be, and so there was an opportunity and permission granted by the Government of Ontario to take the funds of the corporation and to use this reserve fund for charitable purposes. Over the years, much of that funding has supported the history of medicine and the history of nursing. AMS funds the History of Nursing unit at the University of Ottawa, but the caring and compassion really came into being with the Phoenix Program. The Phoenix Program is a multi-year program that is really focused on making a difference to how healthcare professionals provide and sustain their capacity to provide humane, compassionate, person-centered care. It was launched in 2011, and actually we've had a renewed strategic plan in 2016, which is looking broadly interprofessionally at how we can move from our competency technologically based healthcare system to one that really incorporates care and compassion. The way in which we do this is through really strategic investments and partnerships, and so as an organization, AMS views the RNAO as a key partner and leader in nursing provincially. We work with educators, healthcare professionals, and workplaces, and so the kinds of things that we funded over the last year are both the AMS fellowships, Phoenix fellowships, which are directly funded through AMS, and then a particular stream where we've been able to outreach to nursing through the RNAO. Other investments that have occurred in nursing in the province has been within the Call to Caring grants, a grant to the Council of Ontario University Programs of Nursing to really look at the way caring and compassion is taught in the undergraduate curriculum, and to look as nurses transition from the student role into the new practicing provider role, what is that experience like in terms of the content that they learn in school from caring and compassion. But the Phoenix Project is really about all health professions. It's truly interprofessional, and we look to use a diversity of strategies, and I think are really trying to build our social media strategy to really outreach. If you go to the AMS website, we have a new website being launched in early May of 2016, and it will provide some more information on Phoenix and also this fellowship. The Phoenix Project is really founded around three key themes that emerge from how we as health professionals learn and practice from a caring and compassionate perspective. It's partly about how we as professionals do our own character formation, how we're taught or educated and learn about caring and compassion, and what are the ways in which work environments and foster or enable or potentially inhibit caring and compassion. We do ask that applicants identify which of the themes these fit into, although I will say that the important piece really with the fellowship is that it is about caring and compassion, and certainly sometimes people's topics can fit into multiple of these categories. The notion of self-identity is really about me, the person, and how do I develop and sustain my professional self-identity in terms of being a compassionate person. How do I learn and how do we develop providers in our workplace environments in terms of integrity and social responsibility? And so how do I learn and grow as an individual in terms of caring and compassion? Education or knowledge is really looking at what are the educational activities and what curriculum is available to teach compassionate care to health providers. So if you think about a work environment, it's really thinking about what are the educational needs that individuals may have around providing more compassionate, person-centered care within that particular environment. And finally, the work environment, and this is a good example of where you see topics can overlap between education and work environments. Is it may be focused on education in the work environment. It may also be focused specifically around what are the activities that we may be engaged in as professionals in terms of creating healthy work environments and championing behaviors. And I'll give you some examples a little bit later that really speak to learning objectives and goals in each of these categories. So when we think about the AMS RNAO Fellowship on caring and compassion, what we're really, the kinds of questions and ideas that we might be asking ourselves is, what does best practice in caring and compassion look like in my practice environment? How do we nurture and build that? How do we teach caring and compassion? So it might be new practitioners coming into our environment, or how is caring and compassion integrated into new programming? How do we spread and sustain that? So it's really coming at it from that care and compassion. The kinds of relevant topics are often around patient-centered care, compassion fatigue, and again, I'll give you examples in a few moments on that. There is, if we also think about with the existing fellowships, if we think about within the clinical stream that there is in fact a number of approaches that one might be thinking about which actually fit into the AMS Caring and Compassion Fellowship. So if you're interested in patient-centered care and thinking about how do we use patient stories, how do we create more person-centeredness through the use of, and the example I give here is the use of photography at the bedside in terms of critical care. How do we implement person-centered care in different settings, such as ambulatory in the community? If you're thinking about learning about that, and those may be topics which fit, or though they actually do fit with the AMS RNAO Fellowship. Anything around therapeutic relationships is definitely aligned with the caring and compassion. And also thinking about high tech and high touch, which is so important, and an example I have here is how do we find the patient voice within the patient record? And there may be examples that you think of that you may be working on for a clinical stream that again may fit with caring and compassion in the AMS stream. Looking at ideas that within the leadership stream that also fit nicely within the care and compassion, and this fellowship stream is, looking at structures and processes that enable compassion. What do we understand about compassion, fatigue, and resilience, and how do we support providers within our workplace environments? Looking at interprofessional collaboration, and again, how are patients and families engaged in activities within a clinical environment? And I'm sure you'll think of others, but these are good examples of ideas which while they may fall within one stream in terms of leadership, they align very nicely over also with the AMS RNAO Fellowship. I also looked at the best practice guidelines and really identified what are those that if you're thinking about doing some learning and implementation around those, that these really align very nicely with our goals around caring and compassion. The patient and family ones around patient-family-centered care, therapeutic relationships, the whole area of end-of-life care, and cultural diversity in healthcare. From the work environment ones, the two in particular which relate here are the workplace health, safety, and well-being of the nurse, and that's often where the compassion, fatigue, and resilience work is emerging from that BPG, but also in developing and sustaining interprofessional health care. And it's those interprofessional relationships and collaboration in the ways in which we work respectfully with others that sustain us in our ability to provide care and compassion. The next few slides, what I have done here is outlined some examples of learning goals and objectives that which may help to give you some food for thought and guide you as you're developing your application. The example here, which is related to that idea of self-identity, is really how do I grow and learn around understanding compassion fatigue within a care setting. And so you see the overall goal there to increase my knowledge and expertise related to this, and some very specific learning objectives around building on my knowledge of compassion, fatigue, and burnout, understanding best practices related to these, and then looking at learning how to implement best practices to increase staff resilience and reduce compassion fatigue. With this as well, you can think about if there's work done in your environment already, how do I extend, sustain, evaluate that? Within the education theme, in particular here, the example that I've provided is doing some learning and policy and guideline development related to a particular aspect of caring and compassion, which is thinking about family presence in the client settings. And those of you in a diversity of settings may find that there are times when family are included with patients, and there are other times when we tend to exclude families from environments, yet we know the evidence supports family presence. And so the example that I've provided here around education and development is that around family presence during procedures or resuscitation. So a broad learning goal around increasing knowledge and expertise related to this topic, with specific objectives around building on my knowledge related to the impact and outcome of family presence, understanding the policies and guidelines that exist across organizations related to this, and then thinking about how do I develop this guideline within my own setting, then looking towards eventual implementation, and using the guideline as a tool in which to teach and guide peers and colleagues within that particular setting. The final example here is thinking about work environment, and the goal that I've identified here is one both that speaks to the way in which we structure our work environments, also probably overlaps a lot thinking about leadership as well. And this one, the goal is around increasing my knowledge and expertise related to the design and development of quality improvement activities within my practice environment that include patient and family voice. And what we've seen more and more from both best practices across different sectors and in improvement is having really true partnership with patients and families around the redesign of all our healthcare systems. So again, the learning objectives here are around building on my knowledge related to this, the impact and outcomes, understanding best practices across organizations, about how they do this, and then potentially thinking about the development of a guideline for patient and family engagement and quality improvement. Again, this is an example sort of meant to get you thinking about what are ways that I could incorporate some of my some of the work that I'm interested in and align it with the core themes of the AMS Phoenix Compassion and Caring. You will have seen from the other webinars that talk about the development of the Advanced Clinical Practice Fellowship is that we need to identify, sort of as a result of meeting these objectives and strategies, what will be the potential outcomes. And, some outcomes that we see from the examples that I've just provided is thinking about, do I need to develop a documentation tool that includes patient voice more clearly? Have I developed a policy and guideline that I'll be using to roll out with my colleagues? Do I want to evaluate if we've, implementing a guideline on family presence, how might I evaluate that? Also the opportunity to do, in-service or lunch and learns with colleagues about the particular topic. So really thinking about with the learning that you've done, how does that then get translated to your colleagues? I think in conclusion and final thoughts is that I think we all know and understand as nurses that caring compassion is core to the work of nurses and nurse practitioners across all care settings. And what we really hope for is that the AMS RNAO Fellowship creates the opportunities for all of us to engage with others who are interested in caring and compassion within the healthcare setting. So thank you very much for your attention today, and thank you very much for being interested in applying for this fellowship.